Hi, I am Afruzi. I am a virtual occupational therapist, and today I want to talk about what am I doing in my practice. I specialize in few different things. One thing that I work and try to help my patients is their musculoskeletal disorders. It can be anything. People come most of the time to me with pain in their shoulder, pain in their neck, because as you know, I'm located in Midtown Manhattan, so there's a lot of businesses here and companies where people work and they are spending a long time sitting at the computer, and that creates a lot of issues in upper body, can be also lower body from sitting, can be lower back, can be feet, can be their knees, can be their neck, can be their even head. I have patients that I've treated for tension headaches just because tension headaches can be a result of sitting a long time at the computer, and it's tension in your upper trapezius muscles and neck, so like a cervical area. And that's why we work together with my chiropractors and physical therapists. We're working on helping those patients to kind of release any pain they have and improve their range of motion, as well as me doing a lot of manual therapy, trying to kind of release those trigger points and knots that they have by doing a lot of myofascial release. What is myofascial release and why do we need that? We need myofascial release because our whole body is covered by fascia. Fascia is something that connects everything together. We would be now going, arm would be here, this arm would be here, a leg would be here, everything would be separate, but fascia connects it all. And that's why we are one whole thing. And lately, research started to show us that fascia actually is everywhere. It's on our cells, it's on our blood vessels, it's basically everywhere. That's what holds us together. Most of the times, it's important to do the myofascial release because the tightness in the body can be even located in one place, but the pain can be in the other place. We all know about referred pain. I have patients who come to me with a shoulder pain, but then they do x-rays and the MRIs. There's nothing going on in the shoulder. What's going on is the tightness in their upper trapezius. So what I do, I use my cupping. What is cupping? A lot of people that I treated, they were like, you know what? I heard about cupping, but what is that? Like, what does it do? Through my experience, I can tell cupping can do something that I cannot do, which is pulling the tissue, giving a stretch really hard, and then let it go back. This is what cupping does. So basically, what happens? Cupping, we put and we pull. This is a vacuum. It pulls the tissue up and then release. Hands will have difficulty doing that. Why? Because there is not only fascia, we have muscles, we have all the other tissues under the skin, and it will be really hard to do it with the hand. So cupping is really helpful for that. Another thing is, most of the time it helps me to indicate, is there any inflammation or not? Most of the time, the areas that are really red, probably, I don't want to say for sure, because again, I don't have scanners in my eyes to see through, but I assume that that area is more inflamed than the other. Also brings blood flow. What do we need for healing? We need blood flow. So basically, that's why I like cupping, and I see from my patients that it really gives me a good result. But that's not all. My fascial release does not stop with cupping. I'm also using a Theragun. So what is the Theragun? So we apply on certain areas and it gives us some vibration. By the way, the latest research shows that the vibration is very beneficial for the body. And also we can kind of go to certain tissues and make them little, give them a little like movement, because we don't really move this. We move the muscles, but we don't move them this way. All right. So it also releases all the pain that the patient may have. However, I want to say that whether it's cupping or pterygon or even myofascial release, everything is done with the caution. We consider the age of the person, the disorders that they may have. Do they have high blood pressure or not? Do they have any history of cancer? Everything that we do, we definitely do with consideration of their background and their health. Another thing is myofascial release, which we use our hands. In next video, what I'm going to show you what I do.